corneal toxicity? Is that an issue at all?
The corneal toxicity is an issue with betadine. I mean, but I don't know how that will go away because you'll still have to use betadine even with this device. The corneal toxicity really doesn't come from the lidocaine as much, although a little bit can, but it's mainly the betadine.
So the device won't impact corneal toxicity in your view?
I don't think so because the betadine still has to be used, and that's the main cause. I'm not saying lidocaine is not a cause, but I think it's a very minor cause compared to the betadine.
Mm-hmm. Mm-hmm. What about in endophthalmitis? What if this technology lowers the risk of that infection? Would that influence your opinion?
Yes, absolutely. It certainly would, and I think that I think most people would say that. I mean, you can see the uptake of pre-filled syringes, right? And the pre-filled syringes have been very popular not only because of efficiency, which is obvious, you don't have to do a study for that, but because of the assumption that endophthalmitis rates may be lowered because you don't have to mix there in the room. Now, that study will never be done, and nobody's ever done that study, and there's no evidence for that, but you don't have to do studies for everything. I mean, you'll never do a study with this device showing there's a lower risk of endophthalmitis. It'd be virtually impossible to do that study. You'll need hundreds and hundreds of patients to do that, and it'll be way too expensive and not worthwhile. But the assumption can be there that, look, this is more efficient, and it reduces the risk of endophthalmitis, especially if but on the other hand, it depends on what this device requires, but it sounds like it requires a pre-filled syringe from the video.
Yeah, that's what the assumption is. That's what would be clipped into it. I think you just said it would be hard to show that the device would actually lower the risk of that infection because of its rarity. Is that what you're saying?
Yeah, I mean, to show it, and first of all, I'm not really sure the device would reduce the risk of infection. I think the pre-filled syringes will reduce the risk of infections because you're using pre-filled syringes already. So you can argue that whether you use this device or use the pre-filled syringes and just inject, there's no hypothetical reason why there should be a delta in the risk of endophthalmitis. I can see that with something that's not pre-filled, but with a pre-filled, I'm not sure why that should be. So I'm not really sure why this device would even hypothetically reduce the risk of endophthalmitis, but I certainly see why it could potentially increase efficiency. I don't think the endophthalmitis argument as a positive for this device is one that would necessarily fly unless you can convince me otherwise and unless I'm missing something here.
Okay, wouldn't fly. So it's really the risk of infection is relative to the pre-filled syringe. There's no incremental difference relative to the device.
Correct. As far as endophthalmitis is concerned, correct.
Yeah, okay. All right, talk to me about adoption of this device. What are the key considerations to get a device like this adopted into your practice?
Well, I mean, again, like we said before, it'll have to depend on the on the studies and show that it works with one drop. I mean, that's the key. Is if it works with one drop that a tech can do, and there's consistency in not having pain. That's one. The second one is, is it agnostic to any drug, or does it come married with a drug? If it comes married with a drug, does the rebate reflect the added cost? And then the last one is if it's agnostic to any drug, then what is the initial capital cost of that device? And I'm presuming that there are no recurring costs per patient.
If it comes married to a drug, what are your feelings about having your hands tied to a particular drug?
As long as the drug is good, I would have no problems with it, and as long as the drug is good and everything works, and there's a rebate program and it's not priced obnoxiously high, I would have no issues with it.
Is this are the features and benefits of this device something you think patients would ask about, or would you want to talk to them about it?
I don't think so. I don't know how that would necessarily generate more interest or demand for